This is my patient. I had to do someone else than I did on my PowerPoint. Her name is Evelyn Robinson. She's a 35-year-old female. She's here for a well checkup. We're going to do an assessment on her. Hi, how you doing today?
Good, how are you?
Good. My name's Daniel. I'm yours. How you doing? So what brings you here today?
I need a yearly exam.
Alright. You have any issues going on? Any pain?
No.
Okay. I'm going to start off by taking your vital signs. Let me get your temperature. I'm going to do thermometer. 98.6. Perfect. And I'm going to go ahead and take your blood pressure. I don't have a cuff, but I'm going to inflate until I hear sound, and then I'm going to put 30 more in. Listening for that bounding. Boop, 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 boop. Last one. Oh, good. 120/70. That's pretty good. Now I'm going to listen to your, I'm going to get your heart rate if I can. I'm feeling for the palpable radial artery as I'm doing this. Measuring the beats according to time. Looks like we got 80 beats per minute. Good job. Let me check your capillary refill while I've got your finger here. Looks good. I'd say under 2 seconds. I'm going to note the skin as I'm going over her body and looking at everything. I'm going to note that the skin is pink. It is intact. It's moist. Dry where necessary. It is taut. There are no skin lesions or marks, cuts, abrasions. So, I'm going to listen to your lungs. I'm going to listen to posterior first. Yeah, I think you have to turn around for this. Sorry. I'm going to listen up here. Down, I'm going to move to the side and up here. I'm going to go down 2 inches. And I'm going to go straight across. I'm going to go down. I'm going to try across. Go down. And go across. And then do the bottom. And I'm going to go up here. Now I'm just going to listen to your chest. I'm going to notice that there are no bronchi, no crackles, no rails present. Lungs are clear bilaterally to auscultation in all fields and lobes. Alright, from here, I'm going to see if you can tell me what your name is. Sorry, I have to go over it.
Evelyn Robinson.
Sorry. And can you tell me where you're at today?
The hospital.
Can you tell me the date?
November 29th.
Can you tell me the time?
3 o'clock.
All right. I'm going to go and start by checking your skin. If that's all right on your head. I'm going to check the scalp, looking for dryness, any cuts, lesions, swelling. Skin appears to be intact. No dryness is notable. I'm going to go ahead and check the face, look for symmetry. I'm going to be looking at the membranes and seeing if there's any, also the skin, if there's any dryness, lesions, cuts, bruises, marks. And I'm going to start with the patient's eyes. So we're going to do a little eye test. I'm going to shine the light in your eye and see how your pupils react. I want you to just keep your focus on this finger, and you're going to see the light come in. You cannot look at it and just look at the finger. You test to see how your pupils react. I'll get my lights on. Pupils are equal to reaction to light. Pearl is present. Now I'm going to inspect the conjunctiva. You can do me a favor. I'm going to actually pull your eyelids down. You can look up for me while I do that. I'm just going to slightly pull them down and inspect the mucosa. It is intact. No cuts or lesions present. The membranes are moist. Now I'm going to go ahead and check your nose, if that's okay. You can just look up for me. I'm going to use my light, shine it in there. The membranes do appear to be intact. There's no cuts or swelling present. Okay, can I check your mouth? You can open your mouth for me. I'm going to check the oral mucosa, the tongue. The tongue is normal. There's no swelling present. It is pink, clean. The oral mucosa is moist and intact. The gums do not have any lesions, swelling, or cuts. There's no signs of any dental caries present. The tonsils are at +2, and I'm going to ask you to say ah for me.
Ah.
Okay, good. Now I'm going to inspect the patient's ear. If you can, I'm going to pull your earlobe up and look in your ear and see what we're looking at. I'm looking for the tympanic membrane, which is gray and intact. There is no sign of swelling or lesions present. There's no blockage or discharge. Everything is good. Pink, warm, and intact. I'm going to check the same on this ear. I do see that the tympanic membrane is gray and intact, and there is no sign of swelling or lesions present. Now I'm going to put my hands on you and actually touch you and see what your lymph nodes are like. See if there's anything going on there, any swelling present. The lymph appears to be intact. There's no swelling present. From here, I'm going to listen to your heart. All right. Herbs. Then what is the next one? Bicuspid. mitral, tricuspid, and aortic. And as I'm listening, I want to time this as well to make sure that the rhythm is normal and the rate and the rhythm coincide with each other. There are no signs of murmurs, audible, S1 and S2 are in the right place. I gotta make sure I've got all the stuff that I'm supposed to do. Okay, so now I want to check your abdomen. If you could for me, now we're just gonna pretend like you're gonna see. Well, I'll get that seat chair. I'll be right back. That way we don't have to leave all moving that thing. See, that's what I started with. Get this all in one blow.
And it'll just be easier to do it while I'm standing. You're not gonna be able to see it.
Okay. Yeah, it's hard with the video cameras. Okay, first thing I'm going to do is I'm going to listen for abdominal sounds. I'm actually going to go down here. And I'm going to listen over here. Down. Kind of listen for at least 5 minutes to make sure that if there's anything, especially if these sounds are hypoactive, that I'm getting correct reading. Vowel sounds are active and present in all quadrants. Now I'm going to palpate here. I'm going to go ahead and try to find the rib cage. I'm going to make sure that everything's in the right place, essentially. So as I'm doing this, I'll notice looking for signs of tenderness, swelling, any distension. Client doesn't have any distension or swelling present. No edema is notable or characterized. The liver, believe it is palpable up in the upper right quadrant. I don't really like doing this, but I'm going supposed to be never mind. Anyway, so as I'm doing this, I'm of course looking at the patient scan and looking to see, okay, is this is it pink? Is it intact? Is there any swelling, lesions present? Any discharge? Any cuts, bruises? Any moles, macules? It looks pretty good. Everything's in shape. I guess what I should have done too is we would have done a breast examination, I guess, at some point, probably after the abdominal, I would think. When we're going to notice that the breasts are symmetrical, there is no lesions present, no swelling, no discharge. The nipples are in place. There's no discharge, swelling, or tenderness present. We would palpate for the lymph nodes and see if there's any swelling, tenderness, nodules. Everything is intact. There's no irregularities present. So we're going to go on and check what do you call that? There's no way I can remember to do everything. So now, yeah, we're going to do the lower extremity. Lower extremity. So, yeah, we need to sit down for a moment. let's check your legs. I want to inspect them. And check, I guess we at some point would do a pelvic examination and check your groin and see for any lumps, masses, discharge, swelling. There's no swelling present. There's no irregularities present. There's no discharge, no tenderness. The patient doesn't complain of any issues, so we're going to move on to them. We're going to check the legs. We're going to look for distension of the veins. We're going to look for edema. There's no edema present. Doesn't seem to be any signs of what do you call that? Venous I'm going to palpate and see if I can get the popliteal pulse. It is present, +1. I'm going to move down. There are no lesions present, no scarring, no cuts, no abrasions, no discharge. So we're going to go down on this leg before we do the other leg, I think. I'm going to be checking the calf for signs of hemostasis, make sure that the blood return is effective and there's no edema present. I'm going to be looking for cuts, bruises, scrapes, any irregularities. I'm going to check the ankle and the movement. And I check the patient's range of motion while we do this. I'm going to check assess the strength of the feet. Can you push your on me? Good. Then I will take the shoe off and I'll palpate the toes, inspect the aligning, make sure that the capillary refill is good. It's under 3 seconds. I'm going to inspect the feet for any lesions, cuts, bruises, any dryness, tenderness. The